Hello, this is Dr. Priyadarshini, one of the mentors at Study Medic, and today we are going to start our MRCOG Part 1 KickStart series on the module Embryology. Giving you an overview of the module, the important topics not to be missed are fertilization and implantation, early development of the embryo, development of the cardiovascular system, the gastrointestinal system, the genitourinary system. Most importance is given to genitourinary system. Also, a little about fetal circulation and the derivatives of the pharyngeal arches makes it simple to answer all the questions of this module. Sharing with you all some tips and tricks to start. In embryology, it is important to know the timing of the developmental changes. And also, you can expect a lot of image-based question, and hence a pictographic memory is always recommended for this module. Use mnemonics for easy memory, especially for topics like pharyngeal arches derivatives. It really makes it easy before the exams. And whenever you read a topic, try to understand the clinical relevance or the clinical application. It not only makes the topic easy, but also interesting to remember. And trust me, library is a treasure. The library that we provide at Study Medic, anything you name it, it's all there. The summary, the video, and the questions are all there for practicing for the exam. So today I'm going to discuss about the development of the urogenital system. The urogenital system, the important topics to remember are, we have three different derivatives called as the pronephros, the mesonephros, and the metanephros. These are the basic origin for the genitourinary system, of which the pronephros usually degenerates. The mesonephros is of importance not only for the urinary system but also for the male reproductive tract, and it is the intermediate mesoderm which gives rise to all this. Now, going ahead about development of the kidney proper, we have three things that forms. One is called as the pronephros, next is the mesonephros, next is the metanephros. In all the three, we have the duct and the tubules. Coming to the pronephric duct and tubules, they usually appear and disappear in the 4th week, and they arise from the cervical intermediate mesoderm. They are non-functional. So their only role is just they degenerate and do not give rise to any adult structures. Next, we have the mesonephric duct and tubules. They appear at about 5 weeks and they are the primary excretory organ up to 9 weeks. The degeneration of this is seen by around 12 weeks. Now, the origin is from the thoracic and the lumbar intermediate mesoderm. Now, what is the importance of this mesonephric duct and tubules? The duct usually degenerates in females, whereas in males, it shifts the function from the kidney to the genital tract. So, it is going to form the future epididymis, vas deferens, and the ejaculatory duct in the males. And also, we have the ureteric bud, which originates from the mesonephric duct. And this ureteric duct is going to form the future collecting tubules, the calyces, and the ureter. Now, coming to metanephric blastema or the metanephros, this appears by 5th week. It is going to be present along with the mesonephros, and this gets functional by around 10th week. And the origin is from the lumbar and sacral intermediate mesoderm. And it is from this metanephros we have the formation of Bowman's capsule, the proximal and the distal convoluted tubule, the loop of Henle. Or in other words, the kidney proper arises from the metanephros. Now, another structure that is of importance to be remembered is the cloaca. The cloaca is nothing but the membranous part that is present in the most caudal part of the embryo, and this cloaca is going to give rise to the primitive urogenital sinus. And this primitive urogenital sinus has a vital role because this is going to form your future urinary bladder, and also part we have the pelvic part and the phallic part which give arises to the urethra. Now, this is what we were talking about, the primitive urogenital sinus. We have the cloaca, and the cloaca gets divided into the proximal part and the distal part, or ventral and the dorsal part. The ventral part is the one which gives rise to the primitive urogenital sinus, and this again further divides into 3 parts. The vesical part or the most cranial part is going to form the bladder. And the middle part is called as the pelvic part, which is going to form the main part of the male urethra and the entire female urethra. The caudal part or the phallic part, it grows towards the genital tubercle where the external genitalia is going to be formed. And coming to the development of the bladder, as we just saw, the majority of the bladder forms from the urogenital sinus, and we have three major openings in the bladder, the two for the entry of the ureter and one is for the exit of the urethra. The entry of the ureter and the exit of the urethra, we have the trigone of the bladder. Remember, the ureter is going to be formed from the mesonephros. So in a nutshell, the key points to be remembered are, it is the intermediate mesoderm which give rise to pronephros, mesonephros and metanephros. The cloaca is going to give rise to the urogenital sinus. Coming to the permanent urinary system, it is the kidneys which is going to be formed from the metanephros where the main urine production is going to take place, and the upper urinary tract is going to be formed from the mesonephros. That is, by upper urinary tract we mean the ureters, the calyces and the collecting tubules. Whereas the lower urinary tract, the bladder and the urethra, is going to arise from the urogenital sinus. Now coming to the development of the gonads. In the development of the gonads, we need to remember, initially when the gonad starts, it is present in something called as an indifferent stage. That means there is no differentiation into the male and the female gonad. Now as development starts, this gonad gets differentiated into male and female. And the time period for that is considered 7 weeks. And after that, when the gonads differentiate into testis or the ovary, we need to remember it has three different origins. What are they? First one is the genital ridge, which is seen in the medial part of the mesonephros. This is going to give rise to this capsule, stroma, and the connective tissue of the gonad. Next is the coelomic epithelium, which is going to cover the genital ridge. And this is the origin of the sex cord cells, which is the Sertoli and the follicular cells. The most important one is the primordial germ cells. The primordial germ cells are going to arise from the wall of the yolk sac and they migrate towards the genital ridge. And it is this primordial germ cells which are the originating cells for your spermatogonia or oogonia. Coming to other important points to remember, the genital system, as we already saw, we have the undifferentiated gonads which gets differentiated into the male and the female. Now, what is the important thing that leads to differentiation? Well, that's the SRY gene. Now, what is this SRY gene? It is located in the short arm of the Y chromosome, and the presence of this SRY gene leads to differentiation into male, and the absence will lead to differentiation into females. Again, coming to the other important topics, but before that, let me highlight you the time period that we have to remember. The gonadal differentiation, at 5 weeks, we have indifferent gonads. At 7 weeks, the differentiation begins, and by 12 weeks, the differentiation is completed. However, remember, there is something called as a phenotypic differentiation. That means we are externally able to make out whether it is a male or a female fetus. And this phenotypic differentiation is completed by 20 weeks. Now, going on to the differentiation between the male and female, we need to know the origin of the male and female reproductive tract. Now, going on to the structures. First one is the Wolffian duct. The Wolffian duct in the male is important. We have the main structures forming from the Wolffian duct. They are the ductus epididymis, the vas deferens, and the seminal vesicle. In the female, we have remnants which appears as Gartner's duct. However, note that the ureter, the renal pelvis calyces, and the collecting tubules originate from the Wolffian duct. The other name of the Wolffian duct is the mesonephric duct. Coming to the next duct, which is the Mullerian duct, also called as the paramesonephric duct. This is of importance in the female reproductive tract. Now, what are the structures that are being formed? They are your fallopian tubes, the tuba uterina, the uterus, and part of vagina. The appendices that are seen in the male are appendix testis and utriculus prostaticus. Coming to the urogenital sinus, we know in both the sexes, that is in both male and female, we have the formation of bladder and urethra. However, in males, it is also going to lead to the formation of prostate, and in female, few references do say that the caudal part of vagina arises from the urogenital sinus. Now coming to the tubules of the mesonephros, the mesonephric tubules appear as epophuron and paraphuron in the females, whereas in male it appears as paradigmus and ductuli efferens. Now knowing these differences are important because sometimes the homologous or the counterparts are tested in the exam. The one more important topic that is of importance in the urogenital system is the external genitalia. In the external genitalia, again, the important points to remember are what is the origin and what are the counterparts in the male and female. Going ahead, we have the genital tubercle, which under the influence of either dihydrotestosterone or estrogen. Now, in under the influence of dihydrotestosterone, the genital tubercle gets converted into the glans penis, whereas the female counterpart is the glans clitoris. The other thing from the genital tubercle that arises is the corpus cavernosum or the spongiosum, whereas in female it is the vestibular bulbs. Coming to urogenital sinus, this gives origin to the bulbourethral glands of Cowper in males, and the counterpart it's the Bartholin glands or the greater vestibular glands. The prostate again arises from the urogenital sinus in male. The counterpart is the Skene's gland or the urethral and paraurethral glands of Skene. Again, we have the other structures that is of importance to remember. They are from the urogenital fold. The fold give rise to the ventral shaft of penis or the penile urethra. The counterpart is the labia minora. Coming to the labioscrotal swelling, it differentiates into the scrotum in males and the labia majora in females. So the module doesn't complete with this. We also need to do some questions which help us understand where we stand and what more preparation we require. So going on for some sample questions, we have the first question here. When does the metanephros become functional? The options that we have here are 3 weeks, 4 weeks, week 10 of development, just before birth and just after birth. Remember, to know an exact date is essential because sometimes we might have very close options as we have here like 3 weeks and 4 weeks. So we know the metanephros is the one from where the kidney proper is going to be formed, and the kidney proper becomes functional by around week 10 of development. And just a quick recap, we saw the development starts by week 5 and it becomes functional by week 10. Pronephros is completely non-functional in humans, and mesonephros is going to take the function of the metanephros till week 10. Second question, how is the trigone on the posterior wall of the urinary bladder formed? We have either it is the incorporation of the lower end of the mesonephric duct, or incorporation of the lower end of the pronephric duct, or incorporation of the metanephric blastema, or incorporation of the mesonephric tubules, or is it incorporation of the pronephric tubules? Now, the important thing that we have to remember in the trigone is the 3 landmarks which come to the trigone. We have the 2 ureters which enter and urethra which exists. So that triangle is the trigone. And we know the ureter is originating from the mesonephros. So it is the incorporation of the lower end of the mesonephric duct. Understand that there is a difference between the duct and the tubule. And so it is the mesonephric duct which contributes to the posterior wall of the trigone. When does the indifferent embryo becomes completely phenotypic sexual differentiation? Now, coming to the sexual differentiation, as we just saw, we have week 5, week 7, week 12 and week 20. So these are 4 important weeks to remember about the sexual differentiation. Week 5 it is indifferent. Week 7, the differentiation starts. Week 12, the differentiation is completed. But however, the clinching point or the buzzword in this particular question is the phenotypic sexual differentiation. So phenotypic sexual differentiation, as I already mentioned, gets completed by week 20 of development. Okay. Labia majora in the female is homologous with which structure in the male? Labia majora, as we were already discussing prior, we have to know the homologous structures in both the males and the females. And the most apt option for this is going to be scrotum. So it is the labioscrotal swellings which is going to form or give rise to the labia majora in females, and the scrotum in males. Now, image-based questions can be expected. Identify the following congenital malformation, and we have various uterine malformations that I mentioned. Having a close look at the picture, we have two fallopian tubes, we have the ovaries. Coming down below, we have two uterine cavity, two cervix and one vagina. So there is a complete duplication, and this is called as uterine didelphys. So it is worthwhile to know the different congenital malformation of the uterus, because we know embryology can get interesting when we have a clinical application along with that. So you can either expect a direct picture or a picture of an ultrasound asking for congenital uterine malformations. So these are some sample questions that is going to help you understand the pattern of the exam, so that can help you prepare better. All the best and thank you.